I hope your week is going well. You know, you guys asked me a fair number of questions about different skin and mucosal changes in the vaginal area. And so I thought I'd make a video addressing some of those common questions and hopefully clarifying some different causes of some of these skin and mucosal changes. Before I get started, today's video is in partnership with Necessaire. Necessaire is a company that makes a personal care product that I'm rather a fan of. It is their sex gel. I've mentioned this in my mature skin care video. It is a water-based lubricant that I'm going to talk to you guys a little bit more about later on in the video. So, as we go through our adult life, we go through many changes as women, starting and stopping birth control, pregnancy, menopause, after menopause, different changes in our hormones, all can affect the skin and mucosa of the vaginal area. One of the most frequently asked questions is about hyperpigmentation on the vulva. Hyperpigmentation on the vulva is pretty common, and you may not be aware of this, but one of the main driving forces for hyperpigmentation on your vulva is irritation, chronic irritation. That leads to something called post-inflammatory hyperpigmentation. Basically, the skin cells in that area, they become irritated and inflamed and leak out pigment all over, and the result is hyperpigmentation. A major contributing force to that may be your hair removal practices down there. Waxing, plucking, shaving. Over time, this generates a lot of irritation and inflammation to the skin of the vulva, and that results in hyperpigmentation. Any hair removal technique is going to be irritating and potentially contribute to hyperpigmentation. So there's really no best bet. You know, laser hair removal is probably one of the most gentle or effective ways to go about it, but that certainly can alter the pigment of the skin. It can be irritating and lead to inflammation. The other types of hair removal practices generally involve some sort of insult to the top layer of the skin, like waxing, for example. You're literally just pulling off the very top layer of the dead skin cells very aggressively, and that can be very irritating. Not to mention when you pull at the hair shaft for hair removal, whether it be plucking, waxing, sugaring, what happens is the hair shaft gets fractured, and down deep, the hair just doesn't start growing out straight again. As a result, you can get ingrown hairs that are very irritating, become inflamed, turn into bumps, cysts. As those heal and go away, they leave behind hyperpigmentation. So be very detail-oriented and methodical in your hair removal. If you're waxing, for example, do small areas at a time and make sure that you pull the surrounding skin taut so as to avoid undue pulling of the surrounding skin. If you're shaving, make sure that you use short strokes and that you use a clean, new blade with each time that you shave that area, so as to not only avoid irritation from a dull blade, but also to reduce the risk of inoculating bacteria into your skin as you shave the hair there. That bacteria into the skin can cause inflammation, little rashes, little pimples that can heal with hyperpigmentation. So take short strokes, don't do broad areas all at once. Make sure that you use some sort of a barrier, like a shaving cream or shaving gel when you shave the hair there. And likewise, if you are pursuing laser hair removal, make sure that you are going to somebody like a board certified dermatologist who has expertise in laser settings, because the settings of the laser for laser hair removal majorly impact whether or not you're going to have hyperpigmentation. Certain lasers are not appropriate for certain skin types. They can really set that individual up for a lot of hyperpigmentation. The next change has to do with if you happen to start birth control. One thing you may not be aware of is that it actually can increase vaginal dryness, particularly in the beginning. The vagina has an amazing capacity to maintain cleanliness as well as lubrication. But sometimes when our hormones are in flux or being altered by a birth control pill, for example, some of those hormones that help in the production of lubrication can be a little bit lower, or the signaling there can be affected. And so it's not uncommon actually to have some vaginal dryness when starting a birth control pill, and that can make intercourse uncomfortable. In order to circumnavigate this, it's recommended that you use a water-based lubricant with intercourse. This can really help in decreasing pain and discomfort, or something called dyspareunia, which is painful intercourse. There are a lot of different personal lubricants out there on the market. Most common types are water-based personal lubricants. And these are nice because they are compatible with condoms. Water-based lubricants typically that you might find in the store oftentimes have glycerin added. Unfortunately, glycerin can be irritating. So some people with a lot of sensitivity in the vaginal area should try and avoid glycerin-based lubricants. That glycerin can actually be irritating. And it also can be a little bit more conducive to overgrowth of yeast. A note about the water-based lubricants though, a lot of them are marketed as warming or flavored, and I recommend avoiding those because the flavorants and the warming ingredients tend to be irritants. You got it, they're trying to put fragrance into your vagina, and you don't want to do that. Just like, oh, it's cautioning you against fragrance in your skincare, you don't want that in your vagina. It is very irritating, and that irritation can actually alter the pH of your vaginal mucosa and put you at risk for yeast infections and other pesky infections down there, and a lot of discomfort, which you don't want. So I recommend avoiding the flavored lubricants and the warming lubricants. They're really just irritants. So select one that is flavorant free, tasteless, and does not have any warming property to it. The second type of lubricant on the market is going to be a silicone-based lubricant. Now, these are much thicker in consistency. They tend to be less risky as far as irritation for people with sensitivity, and they are a lot thicker. However, because they are thicker, they tend to stay behind in the vagina much longer. Now, that's not necessarily a bad thing. So, you know, if you happen to use one and then notice that you're having some discharge of the lubricant a day or so later, it's just, you know, coming out because it tends to stay behind a little bit longer. However, a downfall to that is that it can actually make it a little bit more of a hospitable environment for yeast overgrowth. So that's a downfall of the silicone-based lubricants, but they are a much thicker consistency, and sometimes that lends itself to a better overall experience in terms of lubrication and glide. The third type of lubricant that you may be using is an oil-based lubricant. These are things like coconut oil or Vaseline. And coconut oil in particular, I think, is really popular amongst people who are seeking more of a natural lubricant. They like the idea of using coconut oil. But a downfall to the oil-based lubricants is that they are not compatible with condoms. They can break down condoms and compromise your protection against sexually transmitted infections. And if you're using a condom for contraception, then obviously it can compromise that effect as well. Another downfall also to the oil-based lubricants over the water-based and silicone is that they really are associated with a much higher risk of vaginal infections, whether it be bacterial infections or yeast infections. So I don't recommend choosing an oil-based lubricant, but they are really a popular thing. I recommend either a water-based, flavor-free, non-warming lubricant or a silicone-based lubricant. Personally, I really like the Necessaire, the Sex Gel. This is a water-based lubricant. Unlike many of the lubricants on the market, this one does not have glycerin. So if you have a lot of sensitivity, this is a good choice. It has sodium hyaluronate instead, which is a wonderful humectant and much less irritating than glycerin can be. It's a wonderful personal lubricant. I actually use it when I travel in my nose because whenever I am in a dry climate like the cabin of an airplane, my nose gets dry and I'm susceptible to nosebleeds. Also in the wintertime with the heater, sometimes I develop nosebleeds. I find putting this in my nose has been a game changer. It got me through winter last year with heaters. I went through an entire bottle of this, just putting it in my nose. It's really good. It's pH at 4 to 5, which is compatible with the vaginal mucosa, and it's FDA cleared to be used as a lubricant. It is compatible with natural rubber latex condoms, polyurethane condoms, and also polyisoprene condoms. And I actually really enjoy the packaging of this. It comes in a recyclable pump, white pump. so you can recycle the packaging when you're done. And I really like the idea that it's in a pump. I think that's much easier to use than squeezing it out of a tube or dealing with a bottle. And like I said, I travel with mine, and this is great for travel. You don't have to worry about it leaking all over the place. And again, when you finish it up, you can just recycle the bottle. I love this company because they have a real commitment in their intentions to being conscientious of the environment. For example, their shipper boxes are made of 100% recyclable and 100% post-consumer waste, and they use recycled ink on the packaging of the shipper box. And the box that the product is in is made of recyclable materials as well. And so they're really committed to conscientious packaging in terms of thinking about effects on the environment, which I really like. So thank you Necessaire for sponsoring this portion of today's video, but I highly recommend it. And you know, I started using it last year in my nose when I talked about it in my mature skin video, and I continue to use it, so it's a good one. The third change that you may experience occurs during pregnancy, and that is actually varicose veins down there. I mentioned this in my pregnancy skin changes video, I believe, but you can develop pretty prominent varicose veins on the vulva, and that can freak women out. The reason for this is that you have a lot of what's called increased intra-abdominal pressure pushing things down and affecting blood flow, blood return to the heart. Blood kind of pools down in the extremities and in obviously in the vaginal area. It just doesn't have a, you know, it's got more of a journey to circumnavigate now that you have the baby there. And also the little valves on our vein, they're not, honestly, they're not the most well engineered things in our body. Vein valves, they get floppy with time, and they don't keep blood going in the right direction as well. And in the setting of pregnancy, that can even be more exacerbated. So it's not uncommon to develop varicosities in the vulva with pregnancy. Now, I have a video talking about varicose veins on the leg, and you'll recall from that video that I mentioned a way to reduce varicose veins or the risk of varicose veins is to wear compression stockings. During pregnancy, you can actually talk to your OB about a compression pantyhose that will help do the same thing, help in return of blood flow back to the heart and be very supportive. These varicosities, they're not dangerous, but they can be very uncomfortable, and you know, when women see them, they get a little freaked out. For the most part, after delivery, they go away, but sometimes they can persist. So the compression pantyhose can help in not only your discomfort, but in reducing the burden of the varicose veins. Another change, though, that can occur down there with pregnancy is that things get a lot more lax. And the reason for this is that with pregnancy, we make hormones like progesterone and something called relaxin. That's actually its name. And these kind of help in relaxing ligaments and tissues, which, as you can imagine, is a good thing for pushing the baby out. But in the meantime, the side effect of that is that the ligaments and structures that help support the bladder and the vagina can become a little loose. And also the labia and the vulva can become a little bit more elastic, if you will, and quote-unquote floppy. So you may notice that things are just not as tight down there, and that is the result of hormones. That too goes back to normal though after delivery, and those hormones are no longer on board. So I talked about some changes related to birth control, to hair removal, and to pregnancy. But what about menopause? There are a few skin changes that occur down there with menopause. The first is that the appearance of the skin of the vagina becomes much lighter in appearance and almost paler. And the reason for this is that as the hormones change with menopause, we have less estrogen, there is less blood flow to the skin and mucosa of the vagina, and as a result, the skin color changes. Also with menopause, the pubic hair changes a lot. You may have gray hair in the pubic area, but a potentially welcome change that you might also observe is that the pubic hair becomes more sparse. And many women appreciate this. They've been trying to remove the hair down there for so long, and now, you know, it's less dense. So, you know, sometimes that's more of a welcome change. But that is something that occurs with menopause and something that is not uncommon or unusual. But I think one of the things that changes with menopause that can really affect women in terms of their sexual health and overall confidence is that with menopause, we make less lubrication. Not only do we make less lubrication down there, but also we lose elasticity in the vagina. And the combination of loss of elasticity within the vagina and decreased lubrication results in really painful intercourse. And for many women, they almost feel as though their sexuality, they've been robbed of their sexuality. Using a lubricant is something that can help in overcoming this now lack of lubrication. Topical estrogens and vaginal washes that your GYN might prescribe can really be helpful in this situation. Just because you've gone through menopause, that does not mean that your sex life is over and that you can no longer have intercourse and that has to be this painful thing. Last year, when I made the video on mature skin, I mentioned this and it really seemed to resonate with a lot of you. So I wanted to bring it up again in today's video since I have a lot more, many more of you have joined me since I made that video. But it's definitely a very important part of your health, and it's not something that you should feel like has been taken from, feel as though it has been taken from you. But those are some common changes in the vaginal area and the vaginal mucosa. Check the link in the description box if you are at all interested in the Necessaire, the sex gel. Like I said, I really love this product and it's great, fragrance free. I use it in my nose all the time when I travel, and it really helps cut down on nosebleeds for me. So I hope you all enjoyed this video. If you liked it, give it a thumbs up, share it with your friends, and as always, don't forget, sunscreen and subscribe. I'll talk to you guys tomorrow. Bye.